Welcome back to News 3 Today at 11. Dr. Jamal Lawrence is a double board certified family medicine and lifestyle medicine physician leader, recognized nationally as a 40 under 40 leader in minority health and a health equity achieved through lifestyle medicine scholar. He's also the founder of Harvest Health MD, Savannah's first Black-owned and only male-owned and operated direct primary care practice. He joins us now with more to talk about that practice and his purpose. Thank you to your bio for all of that information. Thank you so much for being here today.
Thank you for having me.
Well, first off, born and raised in New York.
Yes, ma'am.
Came down here for training, but you decided to stay here. Why?
For physicians, a lot of times they end up staying where they train. You build networks in the community. You get invested in community. For me, graduating or being promoted out of residency from Memorial, I really did a lot in the community while I was in residency with the homeless care. And so as I developed roots, it just made sense for me to stay here. And then also one of the experiences that I had, particularly with young African-American patients and not seeing Black physicians, really made it something that it put it on my heart to really be here and to be part of the change so that people could have access to physicians that look like them, because study shows that increase their care.
Now, you were also concerned about just the level of patient care, period.
Absolutely, and that's a little bit why I practice the way I do, which is non-traditionally. Because in residency, it was very difficult to take care of patients. The system didn't really allow for you to do the things that you wanted to, or sometimes what was required for patient care. So as a result, I decided to not join that system, but to kind of do my own thing and start my own practice in a direct pay membership model.
Yeah, and so it's kind of like an old school concept with a new school twist that's membership based.
Absolutely, absolutely. You hit the nail on the head. What it does is it takes insurance out of the game, really out of primary care. Nationally, we don't have very good outcomes. We don't have very good infrastructure when it comes to primary care in this country. When you look at developed nations, we have one of the least, we invest the least in primary care, and as a result, we have not as great health outcomes. And so this allows primary care to really flourish, this model, because instead of worrying about what insurance is going to or not going to pay for, you work directly for your patient. They pay the practice, and the practice goes to bat for them. Okay,
so let's talk about the difference between direct primary care, concierge service, and just traditional primary care.
Okay, so awesome question, awesome question. So traditional primary care is insurance-based. It's third-party payer. And so what that means is there is a healthcare provider providing the service, there is a patient that's receiving the service, but then there's also this third party in the background that dictates what things cost and how much things pay. You don't really see that in any other market. Usually whoever's providing the service sets the price, and the person purchasing decides if that is valuable, and there's a direct relationship there. And so because of that, there's a lot of administrative burden and not as much cost transparency. Concierge care gets a little bit closer to direct primary care. It focuses on increased access. Typically people will think that it's for the affluent. It has a membership tied to it, but they also bill insurance. So they're still billing your insurance for the care, and that premium access that you have, the doctor's phone number, that's what you're paying for.
Okay.
And direct primary care, I describe it as concierge care for the working class. We don't bill insurance at all, so that takes it out of the equation. And we just use our monthly membership fee to be able to take care of patients across the board. And ultimately what that results in is less wait times, longer visits, 30 to 60 minutes with the physician. We have ways to decrease the cost on labs, imaging, and medications. But really, ultimately, it focuses on building the patient-doctor relationship and getting back to the heart of what medicine is.
All right, we'll make that the last word because we've run out of time, but I do want to brag on you a little bit because last year you became one of 3 local entrepreneurs to win SCORE's Biz Pitch Savannah competition, and this year you were part of the inaugural class of Launch Savannah. Congratulations to you, and thank you so much for joining us today.
Thanks for having me.
And here's the QR code if you'd like more information about Harvest Health MD. There you go. Thank you for helping me out. You can scan on the QR code, or you can go to our website at wsav.com. We'll have all of that information there. Stay with us. You're watching News 3 Today at 11. We'll be right back.